together and so that we can support one another. So thank you so much for coming tonight and joining us. And now I'm going to see if Sarah is ready. Sarah Shirk, are you ready to go next?
I can. Can you hear me?
I can. Yes, thank you.
Okay. So really what I wanted to talk about today is talking about what is the CDRN and what is the Children and Youth in Disasters group. So the CDRN focuses on bringing together community-based, faith-based, and healthcare organizations to help them prepare their organization for disasters, as well as the individuals that they serve. We developed a subgroup from that, the Children and Youth in Disasters subgroup, that really focuses specifically on the needs of children and youth, and one of those big focuses being childcare providers. Sharon, can you do the next slide? So if you want to get involved into the CDRN or the CYD focusing on children and youth, you can email me and you can email Carol, and we will make sure that you're on that distribution list and a part of that group. Another thing that I wanted to really mention tonight was the importance of preparedness and mitigation with infection control procedures and early learning and education sites and schools. So I was on a call with hospitals, and they really talked up how amazing childcare providers in our region were doing at preparing and using mitigation with the infection control in those sites. And so I just want to reiterate the importance of you doing that in our community, as well as, you know, us being a role model for those children in those sites on infection control. And so then I also wanted to talk a little bit about guidelines for holidays. And so just being aware as the holidays come up that we still need to be vigilant, and you may be doing things a little bit differently, but it is an important time where we can focus on that and talking to the families about what are they doing over the holidays, and really understanding their plans as well and taking that into consideration. So that's my little spiel. If you have any questions or want more information on the CDRN or CYD, want to be a part of the distribution list to learn more about preparedness for your site, please email me and I will make sure you get the right information. Back to you, Jenny.
Uh-oh, there you are.
Here I am. Okay, so next up, we're going to have Dr. Sharon White-Lewis. We are so thrilled to get to welcome you back tonight. I know you've got a lot of great information to share on testing, and thank you so much for coming.
No problem. Thank you for having me back. I am going to go over some of the information that I gave you last time, just so that we have a basis, and then I'll continue on. So we have diagnostic tests, and what they do is they find out if you have active coronavirus, okay? If you have a positive, you should quarantine or isolate, and there's two types of diagnostic tests. One is called a molecular test, or you'll hear it as a PCR test that detects the virus genetic material. And then the other kind is an antigen or rapid test that detects specific proteins from the virus. The third kind of test is an antibody test, and that looks for antibodies made by your immune system in response to a specific virus. So we know that antibodies help infections. Antibodies take several days or weeks to develop, though, and can stay in your blood for several weeks or in some cases for years. Antibody tests should not be used to diagnose COVID-19. And we don't know if antibodies mean that you are immune to COVID-19 in the future. There have been some very infrequent documented cases of reinfection, and that's why some of the guidelines are coming out the way they are. And will these slides be available to everybody? I hope that you can give them this slide and the next slide at least. So here's the molecular test or the PCR test. Here's the antigen test and here's the antibody test. And it tells you what the names are, how they take the samples, saliva, nasal, pharyngeal, which is the one that can either go right in your nose or all the way back to your brain. And the antibody test is a blood draw. The molecular test is slower. It's up to a week to get the results back. The rapid test can be 15 to 30 minutes, but for most places you are informed within 24 hours. And then an antibody test can either be the same day or 1 to 3 days. So the molecular test or the PCR test is the most accurate to diagnose that you have COVID at the time. The antigen test, usually the positive results are very highly accurate, but false positives can happen and negative results may need to be confirmed with a PCR test or a molecular test, okay? And then there's some, what it shows that you have active coronavirus. So tests are based on their sensitivity and specificity. Sensitivity is how many positive cases a test correctly identifies as positive, how sensitive it is to the virus. And then specificity is how specific it is to that virus. And it's how many negative cases the test correctly identifies as negative. Highly sensitive tests have a low false negative rate, but run a risk of false positives. So here's another chart for you to look at. The molecular or PCR tests and the antigen or rapid tests. And the reason I keep saying both of those names is because most people don't call it a molecular test, they call it a PCR test. And they don't call it the antigen test, they call it a rapid test. So the molecular test looks for actual viral genetic material, and the molecular test does, and the antigen test looks for proteins from a virus particle, okay? Oh, one of the things I want you to see is down at the bottom where it says highly sensitive for the PCR test and highly specific, whereas the rapid test is highly specific, but it's less sensitive than the molecular test. Okay, and we talked about that molecular tests detect the genetic material and antigen tests detect specific proteins. Many clinics right now are using either molecular or PCR tests and antigen and rapid tests, but you have to ask them which one you're getting. So if you have a desire to have the best diagnostic test, then you need to ask them for the PCR test. If you want it the fastest, you need to ask it for the rapid test. And there's some caveats with that. There are different testing policies and procedures for different areas of the city. For example, schools and daycares in Johnson County won't accept rapid tests. It has to be a PCR test, whereas Wyandotte County accepts rapid tests. You are considered contagious 2 days before your symptoms start or 2 days before a positive test. So anybody that you've come in contact with and you test positive, they're going to ask you, who were you around 2 days beforehand? Now, the quarantine guidelines have changed recently, but not all counties have accepted them. So when you get in your breakout sessions, you need to talk to your epidemiologist about your specific county and ask them. To return to work, there should be no symptoms for 48 hours without medication, and it should be 10 days after your symptoms begin. Tiers of testing. So it's written out on this website up here extensively, but basically tier 1 is you've been in close contact for a cumulative 15 minutes with a positive person. It used to be 15 minutes at one time, but now it can be 5 minutes, 5 minutes, and 5 minutes to equal 15 minutes. The 2-day rule before you had symptoms or before your positive test applies. Then tier 2 for schools and children is those who stayed 6 feet apart, but they still were in the presence of somebody that has a positive COVID test. And then tier 3 is people use the same space as a positive COVID test, but not at the same time. So they went into a locker room after somebody that was COVID positive. So here's another slide with the tier 1, tier 2, and tier 3. And it says students and teachers and staffs who were within 6 feet apart from the individual with COVID-19 for a total of 15 minutes or more, beginning 2 days before the individual with COVID-19 became symptomatic, or they had the specimen collection that said that it was positive, okay? So COVID testing in schools, teachers, children, and family. These questions. Is there any testing available to schools to help them stay open? So yes, I mean, any of the testing and quarantining helps us so that we can eliminate the people and quarantine the people that are positive and allow us all to get back to normal sooner. Testing is one of the biggest things that you can do, testing and quarantining. It's not fun. I was quarantined and I was in a couple small rooms for several days and my family had to bring me food. So it is not fun. And especially with children, it's not very fun, but it's very important. The question is there any way to be able to expedite the testing for teachers? You can contact organizations and request testing at your facility, but they're so busy that probably is not going to happen. So if you mean expedite the testing, you can do rapid testing and you'll get the results back faster, but it's not as good of a test as a PCR test. And you need to check with your schools and with your jurisdiction as to if a rapid test will count for you. What testing is occurring overall for K through 12 school administrators and public? If you go to the Prepare Metro testing sites, and I'm going to see if I can click on that, and it should switch over. That link tells you all the tests that they have and the information for it, okay? And then you can also contact your local health departments. Okay, again, where to find testing information if you go to Prepare MRCKC. What threshold number are we currently testing at? If you go over here to the data hub, and this is updated daily, it'll tell you our average daily new cases, deaths, hospitalization. If you go up to here to testing, I'm sorry, it's taking a little bit of time to load. It'll tell you per jurisdiction how many tests are being conducted. It also tells you about cases and regional view and the state map. Okay. And then you
Dr. White Lewis,
yes.
a couple of questions in the chat. I don't know. I didn't pay attention if there were instructions whether or not to interrupt you or not, but I'm afraid I'm going to lose them in the chat. Is the threshold, are we still testing at the threshold of 37 to 40? Did the graph show that?
Are we still testing at the threshold of 37 to 40 what?
I don't know. I don't know.
I think what they're asking is about the cycle threshold.
I don't know about the cycle threshold. Sarah, do you know the answer to that?
Sorry, I didn't mean to jump in and like take over here. but it's a question that I fielded from a few folks. It all depends on the different lab and the different assays that are being used. Some assays, their cycle threshold is like 37 to 40. What is average for this area that I know of, and I trust and believe. I don't know all of the things about all of the labs, but between 35 and 40. When I asked the particular lab that we use to process samples from our testing events, they said that their cycle threshold is 35 to 40, but most people that test positive way before 35. So I don't know if that answers the question that was being asked, but there it is. That's what I can contribute.
Okay, other questions?
Let's see, there was one additional question. Is there a test that it tells if a person has already had COVID-19?
They have an antibody test. If you have created enough antibodies for the antibody test to recognize it, then you should be able to find out if you've already had it. If you give blood, by the way, they automatically do an antibody test. So if everybody goes and gives blood, they'll do an antibody test for you. But it's a blood test, and it depends on how long ago you've had the test. It can take days to weeks to create enough antibodies for the test to recognize it. Questions?
I think that's it. Thank you.
Okay. Vaccination. Would you like me to go over the current vaccination as of 3 hours ago?
There's lots of questions about that, so sure. We will have time dedicated to that in January as well, as we continue to learn more.
Well, the good news is today the first people were vaccinated. Yay. We have vaccine. It is 95% effective. And we are thrilled to start vaccinating. I can talk about the priority groups, but I think it's all over the news who gets the vaccine first and how it's being rolled out, but I'm happy to talk about that. What we do know about the vaccine is that it is tested exactly the same way as any other vaccine. We know that we have limited supply. We have 7 different vaccines that are trying to come on the market. They have an emergency use authorization, which means that they can use it right away. What they did to make the vaccine go fast was not to skip on any of the science. Usually it has to do with money. And once you do one phase of the trial, the clinical trial, then you get approved for more money. Then you do the second phase and you get approved for more money. Well, the government decided to go ahead and buy the vaccine up front, and they've already made it pending the results of the trials. So that's where we're at, and that's why we have vaccine now. Moderna, which is the second vaccine, Pfizer was the first vaccine, Moderna was the second vaccine, and we're hoping it's approved next week. You get 2 shots, both of them are in your shoulder, in your deltoid muscle, unless you've got a problem with your deltoid muscle. The Pfizer vaccine is 21 days apart and the Moderna vaccine is 28 days apart. And from what I was told today, now information always comes out, but what I was told today from Kansas Department of Health and Environment is that you should do it exactly on 21 days for the Pfizer vaccine, but you have a couple-day window around that. But you need to be very, very sure that you are getting the second dose of the Pfizer vaccine, because if you go to Moderna for the second dose, it won't work. So we've put some fail safes in there. There's something called vSafe that is an app that everybody can download that will remind you of it, that tracks your symptoms, and that gives you a lot of information. Okay,
Did you say V as in Victor?
V as in Victor, safe.
Okay, thank you.
Okay, more questions and answers?
Let's see. There's another one here about, it says, and I don't know for sure, so it says, so I've heard that the level it shows positive for such a small or minuscule amount that you're not contagious. Is that true?
No. You are contagious. If they're talking about testing,
Yes.
and they're saying that the level of virus in your system is really low, that you're not contagious, is that the question?
Mindy, Mindy, is that the question? Can you clarify? Not hearing her respond, Dr. White-Lewis, so we may have to come back for that.
Okay, well, if you can clarify, but just because you have a really low level does not necessarily mean that you're not contagious.
Okay, a couple of vaccine questions. Oh, Mindy's having issues with her mic. Is the vaccine a cure-all, or does it just weaken symptoms like the influenza shot? And is it possible to still get COVID-19 with the vaccine and still be contagious, possibly?
So 95% of the people that had the vaccine, the Pfizer vaccine, built up enough immunity that we believe that they would be immune. How long it will last, we don't know. I've talked to a virologist from MRCKC, and his opinion, and this is only his opinion and not the CDC or anybody else, but his opinion is that this is not mutating like the flu virus normally does. So he thought, as an opinion, that it was a one-stop shop, that you get your shots, you get your immunity, you get tested for your immunity later, and that the immunity should hold. But we don't know that it makes you immune. We know that there are a few cases of people that were reinfected, and we are believing that it will make you immune, but we still want you to wear a mask, social distance, and be very, very, very careful after you get the vaccine.
Thank you.
Sorry, Carol, go ahead.
Go ahead, Jenny.
I was just going to read the next one. The next question is, has the vaccine been tested against how it works with other medication you might be taking?
They diversely took people with all sorts of comorbid problems. Somebody muted me, so.
Oh.
So they had people with many comorbid problems, and they gave them the vaccine. And what came out of that is caution for the following people. If you are pregnant, then you should look at the pregnancy association called ACOG and see what their recommendation is, okay? And they will be giving you parameters, and they haven't yet because they didn't see any side effects or anything that's happened. If you have an allergic reaction, and 2 people out of 30,000 over in the UK had a severe allergic reaction, you have there's a website for the CDC that gives you options. If you have had an allergic reaction to any of the vaccination ingredients in the Pfizer vaccine, and it lists them on this website, and I just learned about this 30 minutes ago, so I haven't gone and found the website, but it will label you as red, yellow, or green. If you are allergic to any of the ingredients in the Pfizer vaccine, then you are labeled red, and it gives you instructions. If you are allergic to other vaccines, but not necessarily the ingredients in the Pfizer vaccine, then they're recommending caution, and you might not be one of the people that has a vaccination in a drive-through vaccine situation. You might do it in a physician's office or in a hospital. Then you would be considered yellow, and green if you have allergies to food or pet dander or those kind of things. And then they don't have any precautions for you, just be aware of it.
Okay, the next question is there any word about if childcare workers are considered essential and where we might be on the list to receive the vaccine?
You are absolutely essential workers, and you would be in a 1B category. So 1A is all the healthcare workers that are taking care of COVID patients right now. 1B is it, and phase 2 are the firefighters, essential workers, and childcare people are considered essential workers. Right up there with teachers, firefighters, police, those people.
Let's see. Oops. Sorry, mine just moved. And Dr. White-Lewis, I'm not sure if this is would also be covered on the website that you spoke of that we can get out to people perhaps, but it says, I have heard that there is a concern regarding women of childbearing age and women who are pregnant taking the vaccine because it causes sterilization even temporarily.
I love it when these rumors come up.
Right?
No pregnant women have been in any of the vaccination tests so far, so we don't know about pregnancy, but there is no indication of childbearing years that it has any effect on reproduction. Absolutely none.
And is there any plan or milestone to reach with the vaccination process before it would be advised for children to be receiving the vaccine?
They have started enrolling adolescents into a Pfizer vaccine right now. So what they'll do is they'll start walking down the age groups. The next group, anybody 16 and over is advised to get the vaccine. Anybody under 16 and adolescents needs to wait until the next clinical trial with children comes along, and then they will start walking it down in ages.
Thank you. Will the vaccination be required to be taken by childcare providers?
It is not mandatory anywhere yet.
Is there any talk at the state level? This is from a Kansas provider of making it mandatory.
No.
Okay. Mindy, I'm going to come to you next if you can unmute and be ready. Are family members in phase 2 for home care providers?
No.
All right, Mindy, are you available to ask your question?
Yes. So at the threshold level of 35 to 40, there's several articles back from July with Dr. Fauci saying that it's too sensitive and that it's testing such minuscule amounts that it's not contagious at that level. Is that true?
That is not the information I've got, and why would you ever want to take a chance?
Right. It's more curiosity of knowing that these positive tests that are showing up, are they accurate?
There's a lot of information out there and misinformation out there.
Right.
What we know is that when people social distance, mask, and test, that our numbers in the city and the metro area go down.
Right.
And when they don't, quarantine, and when they go to bars, and when they go to crowded restaurants, and when they don't wash their hands, that they go
Right.
up and that people are dying. You know, the other day we had 3,500 people die in one day, and that's more than the 9/11 incident. And that's in one day.
Yes.
And I just can't see that anybody should take a chance. So if the test is really sensitive and you're not contagious and you have to quarantine for 10 days and you say you potentially save somebody's life, why would you not do that?
I totally agree. For me, it's just curiosity as to what level we're testing at, and is that the level that we should be testing at, I guess.
I think over the next few years, we're going to learn a lot more about it.
Right,
I think that we will take more chances and hone it down.
right.
But what we do know is that we're not on top of this. We still
Yeah.
have, our goal is 15% positive tests, and we're getting 17% tests. And that, if that was true, then we wouldn't see increased admission in the hospitals, but the hospitals are getting overrun. And let me there, I've seen some news reports, you know, that there are beds open in hospitals, and they're lying to us that the beds, there aren't open beds. It's not that we don't have beds. We have some beds, and we can put up alternate care sites. We don't have nurses.
Right.
We don't have staff to take care of these people. They're staying longer. They're much, much sicker. And 400 of our nurses, the last I heard, 400 of our nurses in the metro area are out with quarantine or COVID themselves.
Yes. I've got a friend that works at a lab. She's in charge of a lab through the VA hospital, and they're having a terrible time. Either they're in quarantine or they've got COVID.
Yeah. Pamela, would you like to ask your question? I believe I read it incorrectly, and want to give you the opportunity to discuss it with Dr. White-Lewis.
Yeah, I'm not sure. So, Dr. White-Lewis, the information that I read was not rumor. I was the one that asked about the UK. It was written down in a research paper that they are actually recommending that their pregnant women and their childbearing women not take the first round of the vaccine.
So
I have friends. I'm a little concerned about all the data that talks about the COVID deaths, because there's many data sites that show that it's much lower when you separate COVID only deaths from deaths that have multiple symptoms and the individual gets COVID. So I request in this conversation that this meeting, and if other people need to do this, I'll be happy to sign out, not be about fear-based development of what's happening out there. Rather, it is factual in what we just need to do, period. As a child care provider, here's how you can get your vaccine if you wish. Here's how you can get your COVID. It started out great. The whole conversation with I don't know, I wrote it down, PRC or whatever it is. I can't wait to get your PowerPoint, but I just request that, I request the data you're getting, because I'm a researcher, and the data I'm getting isn't documenting what you're talking about. I have friends who was with someone that got tested and was positive. 3 different times this happened, and nobody else got the test because they were out of test that day. And the friends all got called by the health department and was told, oh, by the way, you tested positive for COVID. And they said, how's that possible? I didn't get a test. And they says, well, I don't know, but you did, and we can't change the results. So, and that's personal. Those are individuals that I know personally. So I just request that we keep it factual, because I know that there's a lot of stuff out there that is very fear-based, and we have enough to deal with, taking care and protecting our children and our teachers and our families. I mean, I sent 4 kids home Friday with fevers and a runny nose, which I never would have done. But those are symptoms of COVID, and I would not let those children come back until they had a doctor's note, and every single doctor's note said they do not have COVID. So thank you for letting me have my piece. I'll be happy to sign off if that offends anybody.
Doesn't offend me in the bit. How they determine the deaths is a good question. Is it everybody that's died that has a positive COVID test, or is it the people that die from COVID? I agree. I totally agree. And I don't know the answer to that. I could find out for you, get back with you, but I don't know the answer to that.
And I can tell you, Dr. Sharon, Dr. White-Lewis, that I have centers in 2 states, and I have individuals that work in the health community, and they have told me that they are told that all deaths are to be diagnosed as COVID, period, whether they are or not. Those are from medical professionals that I know personally.
That's
so
disappointing. If that's true, that's very disappointing, and I hope it's not true, but if it is, that's so disappointing, because we're all making decisions based on those.
Thank you so much for that discussion. Appreciate that. Based on the current number of vaccinations available, what's the possible timeline for receiving the vaccine based on our priority as essential? 1 month, 6 months?
Well, the first vaccines were given today. They think that it'll take 5 weeks to do 1A. And that's if everything goes correctly. The Moderna vaccine is approved, and ACIP approves Moderna also, because it's not just the FDA, it's the infection control people. And so they were talking about 1B and 2 being late January, early February. Now, in saying that, I'm sure you saw the information that the government did not lock in the next 100 million doses, that they only locked in the first 100 million. So we'll have to see if we still have the availability, or if Pfizer and Moderna sold it to people around the world. And I don't have the answer to that one right now.
Thank you. I don't believe I see additional questions.
Carol,
Jenny?
I want to ask one because I see it in here twice. So
Okay.
I want to make sure that we got it. I'm getting lost in the scrolling as well. If you're directly exposed, should you go be tested immediately or wait until symptomatic? And how do those that are asymptomatic fit into this? Did we ask that one yet?
No, you haven't.
Okay. Okay.
So you should quarantine yourself and go get tested 5 days is the most recent information that I've had. That if you go too early, that you don't have enough virus in your system for the test to be able to detect it. And there are some places like Wyandotte County, they won't let you come and test prior to, I believe it is 5 days. It was 7 days at one point. But if you went to their testing site, they'd turn you away. So the last that I've seen is, and that was a couple days ago, was that that you should quarantine yourself, but you should get tested in 5 days.
All right, I saw a raised hand from Sonia Gordon.
Can you hear me?
Yes,
Yes.
ma'am.
Okay, I was just wondering if they are doing tests on small children, like the 2-year-olds and the like.
Yes, they are.
Okay.
I suggest that you go to find out where you're going. Some of the tests that are way back in the back of the nose, they will, if they know that a small child is coming, do it right in the front part of the nose so it doesn't bother them so much. And just call the health department that you're going to and let them be aware of that possibility. Also, there was a developmentally delayed person who was told inappropriately, and there's a lot of mistakes going on, but there's a lot of great work going on out there, that they had a nasal swab because this young man couldn't spit into the test tube, and they went to a site that was only test tubes, and he could not do it. He can't follow directions. So it's a good thing to look at where you're going and what type of tests they have, because there's a lot of different tests out there.
Okay. All right.
So it is 7:27 and we are going to breakout rooms in 3 minutes. I see 2 more questions. Does it make a difference if you have had the virus when you get tested?
You mean previously? You can have the virus still in your system. Sometimes they're saying up to 3 months. So you can test positive for a very long time. That doesn't mean that you will and that everybody will, but it does mean that some people that are not contagious will test positive after they've had the virus.
Okay, she didn't say what she wanted. Let me ask again. Does it make any difference if you've had the virus when you get vaccinated?
Oh, when you get vaccinated? I don't know the answer to that.
That's a good question. Yeah.
Yeah, I don't know the answer to that. That's a good question. I'm going to write that down and find out.
Okay, we've got another specific one about when to get tested. If wearing a mask, how does the affect how likely you are to get it? When should you get a test if both people were wearing a mask?
5 days after you're exposed to the person that had the positive.
How long after vaccination can we ditch the masks?
They're still working on that. The trials that they've done are with a few thousand people. When we get to 30,000 or 50,000 people and see how long it lasts, then you'll be able to go to the movies without the mask. But until then, you should wear a mask, social distance, and wash your hands.
Wonderful. Well, Dr. White-Lewis, I can't thank you enough for coming back and fielding all of these questions. We are now going to turn our attention to breakout rooms. So when you came in, we asked you to put your county or jurisdiction behind your name. And so we are going to be using that to send you to breakout rooms where we have, I believe, almost every jurisdiction has their local epidemiologist available. And in these breakout sessions, you can ask them questions, but additionally, they might be talking about things specifically that your county is doing different, as well as what testing for children and adults looks like, if any of that is different than the general testing guidelines. So we are going to go to those breakout sessions next. Nancy, are you ready for that?
Jenny, if I could just mention quickly also, if for staff or any representation from the counties or jurisdictions, when you get into your breakout rooms, if there are no participants that join, then feel free to, our staff, if there are any additional questions from providers that you know that you can ask, do so. And then you all can decide whether to, one, join another group. You can come back into this large group and we can reassign, or of course you are free to go. But I just wanted to give that heads up because it might happen that some groups may not have any participants.
Okay, so this is Nancy. Y'all cannot be patient with me, please, because I tried to get you in the right rooms. If you're not, just choose leave the breakout room and come back and I'll put you where you would like to be. I did the very best I could. I have about a dozen folks who did not have it with their names. So I'm open. And Jenny, when they're done with their rooms, they're done?
They're done. They're going to leave from the
Okay.
breakout room.
So I have great conversations. Those of you that are hosting, take good notes. And the room should be open for everyone. You'll just have to choose yes. And those